Unfortunately, everyone is at risk of getting both influenza and COVID-19. Healthcare workers, by the nature of their jobs, are particularly at risk. Healthcare workers are 10 times more likely to get influenza and 3 times more likely to get COVID-19 when compared with the general population.
Influenza and COVID-19 strains are constantly changing and evolving. Just because you've been sick with COVID-19 or flu before does not protect you from becoming infected again. High levels of vaccination among healthcare workers protects you, protects vulnerable people in your care, protects other people at work from becoming infected, but also protects your family at home.
Every winter, due to influenza and COVID-19, we see an increase in infections, hospitalizations and death. These illnesses are serious and can lead to life-changing or lifelong complications. Even if you yourself don't become unwell from these infections, there's also always the chance that you might pass it on to someone more vulnerable who will.
Healthcare workers are at risk of getting COVID-19 and flu more than the general population because of their job. That's why vaccination in healthcare workers is so important. Plus, by extension, it prevents the risk of infection from spreading from healthcare workers to vulnerable groups.
No, you can't. It's not possible to get either influenza or COVID-19 from the vaccine. Neither of the vaccines contain live viruses within them. However, both vaccines do take approximately 2 weeks to take effect. So during that 2-week period, it is still possible to get sick with COVID-19 or influenza. And that might account for people still getting sick after they've been vaccinated.
The immune system is capable of responding to 100 trillion antigens at any given time. Vaccines contain a tiny fraction of this, in fact less than 100. After the body has developed an immune response, the cells discard all of the substances that are no longer required.
The flu vaccine significantly reduces the risk of influenza in people who get vaccinated. It also reduces the severity of the illness and reduces the risk of complication. Regarding COVID-19, the protection you would have previously gotten from previous COVID-19 vaccines or from previous COVID-19 infection wanes over time. That's why it's really important to get the booster dose to top up your vaccination and ensure you're protected going forward.
COVID-19 vaccines undergo rigorous testing and clinical trials to ensure they meet internationally agreed benchmarks for safety and efficacy with ongoing monitoring. Over 1 billion doses of COVID-19 vaccines have been administered to date in EU, EEA countries, with 0.2 per 100 doses of side effects being reported. This means the vast majority of people have received the COVID-19 vaccine safely.
Most people don't get any side effects from the COVID-19 or influenza vaccine. And those that do, they tend to be minor and might include some localized tenderness at the site of the injection, some generalized aches and pains around the body, or a slight increase in your temperature. These tend to be self-limiting and will go away after only a few days. Infection, however, from COVID-19 and influenza can lead to very severe consequences. If you have any questions, we recommend you speak to your GP or pharmacist.
Children are twice as likely to get flu than adults and are also much more likely to be sicker than adults are. Therefore, it's really important that people know that flu vaccination is recommended for children, and this is easily given via nasal spray into each nostril. It's fast, it's painless, and it is free.